Does your child speak poorly or not speak at all? Developmentally delayed? Is it difficult for him to study? Like any mother, you are seriously worried about his future. Did you know that all children who work with high-frequency therapy programs change their destiny? They become talking, smart, and make their parents happy. Programs accelerate the development of problem areas of the brain with audio training. The child simply listens to the program using regular or special headphones for 20-60 minutes a day for a month. The dynamics happen quickly, effortlessly, and sometimes even without exercise. Whom does high-frequency therapy programs help? A child from 2 to 15 years old who speaks poorly or does not speak at all, with any delay in general development, inattentive, hyperactive, who has difficulty learning, as well as a child with autistic traits, autism, cerebral palsy, or Down syndrome, or any genetic disorders. The program can also be listened to by an ordinary child if parents want him to become very smart and learn easily. Moreover, this can be done even before birth. There are programs for babies in the tummy. And of course, there are platforms of programs for adults, for restoring brain function after damage, such as stroke, traumatic brain injury, consequences of COVID infections, or increasing the general intellectual level and creativity in general. The programs have been in use for 16 years, and thanks to them, more than 10,000 children started talking, went to regular schools, and significantly improved their academic performance. According to research results, the effectiveness of the programs is 99%, and to create them, we used the world's best recording equipment and software from Avid Technology. Therefore, more than 100 speech therapy centers already use them in their work. The work of the program begins from the first minutes of listening to it. Speech perception improves, connections are formed for quick understanding of speech by ear, clarity of pronunciation and dialogue. This is how we get away from echolalia. Memory, general and fine motor skills, self-care and drawing skills improve. The attention zone is trained, and areas of intelligence and learning are stimulated, in particular writing and reading. And the main achievement of the high-frequency therapy programs is the rapid improvement of sensory integration. They form subcortical-cortical connections, and the child becomes switched on with the correct sensations of himself and his body, that is, step-by-step, normotypical. The know-how of high-frequency therapy programs is the use of special bone conduction speakers along with conventional ones. When listening, bone conduction speakers are located on the projection of speech zones, which helps restore phonemic hearing completely. Moreover, all the speakers, 2 upper and 2 lower, are used to form the stimulation effects of the program, which increases the effectiveness of listening significantly. How to get the program? You can form it yourself. Take a free survey on your child's development, and within 15 minutes, he will be able to start listening to his individual course. You can take the standard course of the program at any of the partner centers in the world. There are more than 100 of them in different countries. You can also order an individual course of high-frequency therapy from a specialist. In any of the options, from the very first sessions of the program, the child's development will progress steadily throughout the entire program. This is 4 to 5 weeks and another 3 or 4 months after its completion. There are no contraindications to using the program, since the impact in the programs is through speech and music, and listening is done using headphones and a phone or laptop, and no medical equipment is used. But if you have brain tumors or epilepsy in the acute phase, it is recommended to talk to a specialist before listening to the program. Shape your child's successful future using effective and time-tested high-frequency therapy programs and make him the smartest among his peers.